Welcome. We're talking about Texas de Peru today. For those of you who are joining us live, welcome. For those of you who are downloading this and watching us less than live, thank you for downloading us. Today, we've got a special treat. One of my favorite people. I've got Dr. Margot Abundis, and she has been a volunteer with our program for, goodness, I don't know how many years now, but she's going to share her perspectives, and we're going to have a good time talking to her about what we are trying to accomplish down in Peru. Margot, welcome.
Thank you, Kevin. Thank you for having me.
Oh, happy to have you. And so tell me, how did you find our merry little band, and how did you get involved with this? What inspired you to do something like this?
I found you guys on Facebook, of all places. One of the volunteers that you had probably 6 years ago was a classmate of mine in medical school, and she had gone on this trip and posted pictures on Facebook. And when I saw this, I reached out immediately to her and then to you to ask to be part of this incredible team. Little background, I'm in Michigan. I'm not in Texas. So I call myself the Michigan branch of Texas de Peru. And this has been very special to me because I lived in Peru. Those were my high school years. So I feel like I have a connection with the country, with the people. I speak the language, and it's been just a inspiring, life-changing experience.
Well, we're thrilled to have you. I can't tell you how much better off we are and our patients are that you've been a part of this thing. So
thank you.
So the teams that you and I've been on, we've been doing gynecology, not me, but you. What are some of the procedures and the needs that we're seeing most of down there?
We see patients that come in for basic exams that just want to have a checkup, just for well-being, to complex cases that are beyond our capabilities at the clinic, but we get the diagnosis and get their care coordinated so they can get the appropriate surgical management in the larger cities where they have the specialists. We do anything from minor procedures of taking out a cyst to full hysterectomies, repairing bladder prolapse. These women live a very hard life, and there's a lot of prolapse in Peru, and we do quite a bit of that procedure.
Yeah, it's unbelievable how miserable they can be with that. I mean, you can't just imagine spending 15, 20 years not being able to properly sit down. That would just be horrible to me. So in addition to that, are there some unique challenges in the environment there? In your well, like as an example, there are particular lifestyle issues there, the work that they do, the manual labor that many of them, if not most of them, do, contributing to what's going on, or basic economic situation, and what they're able to get in terms of pre and postnatal care.
We concentrate on GYN care completely while we're there. We don't do any of the obstetrical. Most of these women are very poor. They work on the farms, physical labor. They have many children. But we also see women who have college degrees, who work in offices, who just want to check up because we're there. But the women that I think we impact the most on are the lower socioeconomic. These women walk hours to come and see us. They trust us. They know that we're going to give them the best care that we can. And it is a pleasure to help these women.
You know, I was reading a number the other day. The overall poverty rate in Peru is 26%. It's 26% in the cities, but in the rural settings where we are, it's 46%. And if you're poor, 7 out of 10 patients have no access to healthcare. If you're poor, I'm glad that we're there, and I'm glad that the clinic is there, filling in the gaps where we can on that. Do you, what's it like? from a collaborating with the office team there, the nurses at the Kasiwasi Clinic have on staff for you?
These nurses are incredible. The
Yeah.
clinic has an interesting setup. When we get there, we have a lot of the preliminary studies done so we can quickly address the problem and that same trip be able to perform their surgeries without waiting for diagnostic studies. The nurses have been incredibly trained. Guido, the founder of the clinic, makes sure these nurses get training in the United States. So I feel completely comfortable with the nurses and the collaboration that we have with the team there.
And a lot of those nurses have been there since the clinic's founding.
Mm-hmm.
I think Mary and Jenny have been there at least that long.
Yeah, they're an incredible team. They are there to care, they care for their people. They are more than receptive when the teams come in and have open arms.
So let me shift gears for a second.
Mm-hmm.
Can you share a particular story, or is there a particular patient or experience that really sticks out in your mind of a patient you've taken care of down there?
The most that I find impactful is these women have tried to go to other clinics and they don't get the care. So when they come to us, I don't want to say are desperate, but they know that at this clinic, the chances are higher that they are going to get the care that they need. Most impactful was probably 2 trips ago. We had an older woman who walked 3 hours to get to the clinic because there was a transportation strike and she knew she had to be there for her surgery. Those are the cases that make the difference. We are there to help patients like that.
I would imagine that she's been suffering. It's been suffering with that for at least a decade,
probably more. Mm-hmm.
And if it wasn't going to be today, it was never going to happen for her. So, yeah, that's quite a story.
A lot of these women also, if they have incontinence, that's a social stigma.
Yeah,
they don't like to talk about it. And when they hear that we're coming and that we will take care of these problems, they start talking and they start asking questions, and they're more willing to come and get the help that they need.
Yeah, I think we're building a bit of a reputation there.
I think so. Being on the radio waves, being on Facebook, being on Instagram, it's amazing. They may be very low socioeconomic, but they have Facebook.
Yeah, it's
or just the radio, the good old fashioned radio.
I love the radio station. In addition to playing the hits of the 60s, 70s, and 80s, they're doing PSAs, public service announcements for, hey, come down and get this condition taken care of at the clinic. That's pretty cool. So let me ask you a question. How has this experience impacted you personally and professionally? Have you done a mission like this before doing something like this?
I had never been involved with a team like this. This has been so impactful that I've taken my daughter twice. I've recruited my sister-in-law, my niece has gone, my nephew has gone. I've had nurses and staff from my OR here in Michigan go. That to me speaks volumes. If I'm willing to take my family and the people that I work with day in and day out to come and be part of this team.
I think you're outpacing me.
I am.
As the number one recruiter.
I am. Yes.
I'm very okay with that and very thankful for that.
No, this has been my only mission trip, and for now, this is going to be my main group because I feel a connection, not just with the team, but with the country, the people, Guido and Sandy. It's almost makes me emotional thinking about this trip every year.
I know this sounds strange. I've seen hundreds of volunteers come through our program. I find myself missing the friends that I have not yet made because I know I will.
Mm-hmm.
And
this last year was the first year that you brought down the pre-med students, and I was not sure about this program, how these kids were going to be It was great. It was great for us sharing what we do. It was great seeing these new kids with energy. It truly transformed the feel of the group. Um, it was a great program.
Well, I'm glad to hear that. We can't prove it yet, but I'd like to think that we're making better doctors.
Hopefully, I agree. And for them to experience not just the US hospital and to be able to think outside the box. We don't have all the supplies we typically have. We know how to do surgery and we make it work.
You know, that they were working so hard in the sterilization unit.
Mm-hmm.
Oh man, what a lifesaver that was from my perspective. And it was fun to watch them quizzing each other on the instruments, what they did and what they are.
Yeah. And then coming out, quizzing each other on anatomy, and they were having a lot of fun and learning at the same time.
You know, I've been interviewing a lot of students over the last 4 to 6 weeks, and I think the word's starting to get out a little bit about what we're doing, because it's such a rich experience. You know, it's hard to get that many hours in such a short amount of time and have that rich experience where you're basically getting to experience so much.
Mm-hmm.
And it's not just experiencing, you know, the procedures, but basically experiencing the culture or experiencing any culture through somebody else's eyes and seeing the world a little bit differently. I think that's just a boom.
It's good. Yeah.
So for anybody that's interested in volunteering, any advice you'd give them?
Reach out. The information is right there. Reach Kevin at texastoperu.org. Go on Facebook, follow us on Facebook, ask as many questions, and get involved.
That covered it really, really well. Margot, a delight as always.
As always, Kevin. Hasta luego.
Hasta luego.
En julio.
En julio.
Okay.
Adios.
Adios.